Thanks very much, Ross, and to all of you for joining. We're on a strict time limit, I'm afraid, today until past. So I'll be as brief as I can be to get to your questions. This is a briefing in two parts today. Firstly, on COVID, we just wanted to show you the latest picture because it is a changing picture, but then a reaction in the second part to the spring statement. So I'll get straight to COVID, colleagues, if that's okay. And if we could show you the first slide, what you can see here is there is quite a significant increase in all 10 boroughs in the last week in the number of cases, particularly high in Stockport and Trafford. This is a combination, we think, of waning effectiveness of the vaccine combined with obviously more social mixing, less observance of the measures, but that is clearly a picture that needs to be watched. If we could take it to the next slide, by age, also say the over 60s, you can see again high case numbers in the over 60s across all boroughs and quite significant rises over the last week. We quickly move on. Picture in care homes, thankfully not showing the same picture, so that's encouraging. If we can move on to hospitalization, because this is again a slide that needs to be looked at. What you can see there is that there has been a significant increase in weekly admissions over the last fortnight, and people being diagnosed with COVID in hospital, also rising quite significantly. And then below, you will see that is mirrored in terms of the number of patients in general hospital beds, 620 at the last count, not translating though into pressure on high dependency and intensive care. So this possibly, as I stress possibly, reflects the fact that the obviously what we know about Omicron was that it was transmissible, but potentially presenting milder symptoms. There is a variant of Omicron that could be even more transmissible, but it's clear that we're not seeing that translation into cases in HDU or ITU. So it is a picture that needs to be watched, and that's why we've put it before you today. We look at the vaccination figures. Obviously, we've had some moves from the government with regard to over 75s and those deemed clinically extremely vulnerable, able now to get a further booster. I think that is timely, and obviously we would want to obviously draw the attention of our residents to the figures that I've just presented to you, and we would encourage those eligible to go forward, including those in other age groups who are still eligible for their booster to take it up. And I'll finish with this point on COVID, and this is a call on the government. Obviously, that picture is changing and changing quite significantly. I'm not today going to call for any widespread introduction of measures. I think we've moved beyond that point. But what I would say is it would be a mistake, in my view, to remove availability of free lateral flow tests from the 1st of April, because individuals will be at more risk from that, unable to test themselves, and families will be at more risk, and workplaces. But also our ability to monitor the spread of the virus will be much diminished, and the surveillance function much reduced. And we don't believe that is a sensible step to take at this point in time. So I'm very much echoing here the advice of our lead Director of Public Health for Greater Manchester, Professor Kate Ardern, but speaking for all of the directors of public health, in saying that we believe the government should continue to make free lateral flow tests available from the 1st of April, given this most recent wave that we are clearly experiencing. With that, I will move on to the spring statement. I'm sure more of you are on for that purpose. So let me just give you a reaction to what we've just heard. I'm certain that there are many things here that will bring benefits, and there are welcome moves that will help people with the cost of living crisis. So the ones that are most obviously going to help people in the short term are the 5p cut in fuel duty, and of course the raising of the threshold for national insurance, equalising that with income tax. Again, that will clearly benefit many people. But, and here comes my overarching critique of what the Chancellor has just announced in his spring statement. It seems to me that he has chosen to help some people with the cost of living crisis, but has decided against helping all people with the cost of living crisis. And let me just make 3 points to back up what I've said. I listened carefully, but I didn't hear that there was any real help being provided for people on benefits, people who have that low fixed income of being on benefits. So disabled people, older people, families on out of work benefits. They are already, I would say, people who are most at risk from the cost of living crisis because their income is low and fixed. But I don't believe, beyond a small move towards more discretionary funding for local authorities, I did not hear significant support for people in that position. And it's why I will be bringing forward my own package of measures to support people with the cost of living crisis, particularly those on the lowest incomes. And we will do that in a few weeks' time. Secondly, it was clear that the Chancellor had chosen to prioritise some people with the cost of travel, but not all people with the cost of travel. So he's prioritised motorists, but hasn't done much, if anything, for those people who can't afford to run a car and are reliant on public transport. And if I could just, to back up this point, show you a slide that we have prepared, which is picking up the emerging evidence, particularly about bus fares, but also rail fares, which you will know about. Obviously, what we can see here with buses is significant increases, and it is often the case, of course, that people on out of work benefits may be more dependent on bus travel. So that will be a double hit from their point of view. But those are significant increases. If you look at it across the decade, bus fares in English metropolitan areas increased by a third, just over. That is a huge increase, but these are big increases coming this year. And then alongside the cost of rail for people reliant on public transport, very little in this spring statement. And if I can make then a third point and final point, obviously, if you look at the north of England, what you will find is that there are more people living here who can't afford to run a car and are reliant on public transport. But there are also more people who are dependent on benefits for their income, either in work or out of work benefits. And therefore, if you take those two factors and put them together and you consider what the Chancellor has announced, you can't come to the conclusion, anything other than the conclusion that this is a package that won't close regional inequality and possibly could see it widening over the course of this year. And it was striking that levelling up, to the extent that it got a mention, it was a very cursory mention towards the end of the Chancellor's statement. And the question I would put to the government is levelling up still the core mission of this government? Because there was very little evidence today to suggest that it is. Ross, I will leave it there, and in the 20 minutes we've got left now, hopefully that's plenty of time for any questions that colleagues from the media have today. Thank you.
Thanks very much. Thanks, Andy. If colleagues from the media who would like to ask a question could indicate by using the raised hand function, like some of it may say react at the top. I see Alice, Helena, Joseph. That's great. If anybody else wants to ask a question, please do stick your hand up now, because obviously we're at limited time, so I'll be able to kind of come to you. Great. I'm going to go to Alice. Alice, if you just say where you're from, you should be able to open up your microphone and camera now.
Oh, thank you. Yeah, it's Alice here from Global Radio. Just a quick one, Andy. I just wanted to ask you about the FA Cup trains drama that obviously we are seeing happening. Just wanted to get you on that really. What, well, your hopes, do you think the venue is going to change? Do you think there's potential the semi-final will be moved from Wembley? If not, do you think it's up to the clubs to put on transport for fans, for example? What just your thoughts on that, on all of that really?
Yeah, thanks, Alice. You couldn't escape the phrase over the last couple of years that football without the fans is nothing, and yet you see this decision and you think, well, clearly that's not the case. Fans are still quite some way down the list of considerations when it would seem that the FA is scheduling matches. It was made aware of this closure of Euston Station late last year, but this has been, I think, in the work schedule since 2019. We've had a club from the northwest of England in this stage of the competition for the last decade. So this was entirely foreseeable, and it's very frustrating, isn't it? Because it will just throw everybody onto the roads. Bank holiday weekend, already significant roadworks on the M6. It's hard not to think that this is just a recipe for transport chaos, extra cost, probably. Okay, fuel duties just come down, but still, it is probably going to add to people's costs, because some people may have to consider an overnight stay. So it's just far from ideal. And myself and the Mayor of the Liverpool City region, Steve Rotherham, decided to speak up in support of supporters groups from both Manchester City and Liverpool who'd expressed their concerns about it. And I would say to the FA, get round the table with them and, look at the options, because this is far from ideal, certainly as far as supporters based in the northwest are concerned. Having an FA Cup semi-final when there are no trains from Manchester or Liverpool to London, it doesn't seem right. It doesn't seem fair. It kind of reinforces this idea that supporters are an afterthought. Well, show us that you don't think that by getting around the table and coming up with an alternative.
Thank you.
Thanks, Alice.
Thanks very much. I'm going to go to Helena. You should be able to open up your microphone and camera now.
Hi, Helena.
Perfect. Hi, Andy. Thanks so much for taking my questions.
No problem.
My first is that Greater Manchester has just recovered from quite extreme impacts from Omicron in terms of its NHS and hospitals, and public health directors are warning that these climbing rates could see the system put under pressure again, particularly around staff absence as they all start to test positive again. And in January we saw that bring electives to a standstill. Are electives likely to be put at risk again? And could I get an update on the latest staff absence figures if you have it? Also, in light of an interview I did earlier this week with a GP who was being brought some really concerning requests for food from patients just because they can't afford to eat at the moment with the skyrocketing cost of living. What are the plans to combat the inevitable rise in poverty that we'll see and the subsequent pressure it's going to put on our NHS?
Thanks very much, Helena. So, of course, today is the 2-year anniversary of the stay-at-home ruling, and we do have to just pause today and think about what's happened in those last 2 years, the people that we've lost. It is a national day of reflection. I think Marie Curie have asked people to make this a day of reflection about that, because the human cost of all of this, in terms of those we've lost, but also the effect on people's lives, is enormous. And we need to bear that in mind, and also the fact that we are not out of a pandemic, as we've just seen from the figures presented. Now, I wouldn't want to overreact, and I'm not overreacting to what's been presented. To answer your question, I don't believe their electives are not at risk at this moment in time, given the figures that we've seen. But I don't believe it would be right to allow what's happening in our hospitals to go on happening without at least giving it some public attention. That's why we decided to delay things slightly at the start of this press briefing today, to put that picture in front of you. We think it's the right thing to do, not to justify a call for, as I say, widespread reintroduction of measures, but actually to make that simple call to say, please do not abandon free lateral flow testing. I think already families, particularly those who have a more vulnerable family member, are getting worried about that. You know, the cost of these things can be what, 20, 30 pounds a box, you know, and we're talking about cost of living. Some of those people, as I was saying before, are dependent on benefits because they are caring for a family member who will require ongoing care. You know, what position are they going to be put in by this? And, you know, I just would ask the government to pause on this one. If you abandon free testing, then you will lose that ability to monitor levels of infection and therefore your ability to control spread. I wouldn't be able to answer with a percentage on staff absence, Helena, but I think there is an impact. And if I can, after the press conference, I'll ask Ross or one of the teams get back to you with some figures on that. And I did see your report about people going to the GP and the GP suggesting nutritional shakes. I mean, that, you know, okay, it's obviously going to be better than them not having access to food, but that is an indication of the times in which we are living, and it's a very worrying sign of our times. I just mentioned before that we are going to go further in some of the things that we can do to help. We have a food security action network that I've set up, which works alongside the Homelessness Action Network and our Digital Inclusion Action Network. So let me just say a little bit about what I am doing with those three groups, Helena, which hopefully will give you the beginnings of an answer to your question, although, you know, I'll need to say more as we go forward. On food, we are looking at going further on our No Child Goes Hungry campaign, and more broadly, actually, on food security. So the network met earlier this week, and we'll be saying more about that in due course. On digital inclusion, this is important because, you know, people talk about choosing between heating and eating, but digital connectivity has become almost an essential thing for people to get access to services and, you know, be able to access opportunities of many kinds. And yet that's gone even further down the pecking order. So we are looking at bringing forward a proposal for a Greater Manchester data bank, if you like, the digital equivalent of a food bank, so that people who can't afford digital connectivity can still access it via a support scheme at the Greater Manchester level. And we'll be saying more about that in due course. We are committing to running a bed every night at its current level, around 600 places a night for the next 3 years. So that's via our Homelessness Action Network. So there's some of the measures that we're taking there, Helena, but we're conscious that that will not necessarily solve everything. It's going to be a tough year for the groups that I mentioned who haven't been supported by the Chancellor today.
Thank you.
Thanks very much. I'm going to go to Joseph. We've got about 12 minutes left, so if we could keep questions as brief as possible, that'd be appreciated.
Too polite to say that, Ross, but I take the point.
Hi, Andy, can you hear me?
Yes, got you, Joe. Yeah. Okay,
great. Yeah, I was going to ask about the support package, but I think you kind of covered that with Helena's answer. If you could give us any more details about when that will be available from, how it will be funded as well, and when we're going to get more details about it. And then specifically, you spoke about prioritising motorists by cutting fuel duty. Do you support that kind of move at a time when Greater Manchester and the government are trying to actually clean up the air? Is that an appropriate sort of tax cut that you support? And finally, on the general sort of cost of living increase, do you stand by the council tax increases that you proposed yourself and other councils in Greater Manchester have had to put forward this year? But yeah, strapped for time, the priority is sort of more information on that support package, please.
Yep. So just to say a little more about one of those elements, the data bank, Joseph, we are working with big tech companies to see if we can get offers of support from them. So that work is ongoing through our Digital Inclusion Action Network, and we'll bring forward that proposal for a Greater Manchester data bank next month. So wish we could have done it sooner, but watch this space because that's coming quite soon. On fuel duty, I'm not against the cut because obviously that, with the cost going up at the pumps, that's a real pressure on people and it hits many people in Greater Manchester, and the government brings in more revenue, if you like, when the cost of fuel is high. So it's actually, you know, essentially the right thing to do. I'm not saying it isn't, But what I am questioning is why help people rely on one form of transport but not others, and particularly people who don't have a car. So why, say nothing about buses or trams or trains. Buses particularly, we're waiting for support for buses. The government is meant to be committed to a bus services improvement plan, but we're still waiting, and we hear the funding is being cut. So that's why I question how committed is this government to levelling up. It didn't sound very committed to me today when I listened to what the government had said. And this does link to your last point. We are doing a once in a generation thing to put buses under public control. We planned for it for a long time, but obviously we've got to ensure that we manage that. I mean, the whole point of doing it is to get bus fares down, and I've made that commitment to capping adult fares at £2, capping child fares at £1. So this is a move, short term, if you like, but it's designed to get the cost of bus fares down in the absence of government support. In terms of the wider pressure on the budget, in terms of the general budget that I oversee, which is the fire service predominantly, we've also long been working to put in place the capability to respond to a terrorist attack. And there is funding there to make that happen. It's frustrating it's not been funded by central government, but I would imagine as we await the findings of the Manchester Arena inquiry, I would expect that the residents of Greater Manchester to be looking to me to make sure that our fire service is able to respond to marauding terrorist attacks, given everything we've lived through. So it's difficult, but yes, these changes need to be made.
Thanks, Andy. I'm going to go to Owen. If you should be able to open up your microphone and camera now, if you just say where you're from.
Yeah, hi Andy, Owen from Hits Manchester. Just two quick ones on COVID. First, you mentioned the universal lateral flow test. You want them to continue, but obviously the self-isolation support payments, they've been gotten rid of. If cases keep going up, is that something you'd like to see return? And secondly, you mentioned obviously 2 years on from the lockdown. We've been down in St. Peter's Square today with some bereaved families who've gathered there to sort of reflect on the past 2 years. One thing they're quite keen on is to have a kind of permanent memorial, some sort of statue or time capsules or something, maybe in St. Peter's Square, but just somewhere in Manchester as a sort of permanent memorial to, I think it's over 1,000 people we've lost here. Is that generally something that you would look into or willing to do? Thanks,
Owen. So on your first point, I think there is a very strong case for that. We've even had some retail chains saying that even if you're positive now, you should still come into work, which is a ridiculous state of affairs, isn't it? Well, I think it is. So kind of recognizing that we're still in a pandemic and supporting people to do the right thing, particularly if they're on very insecure contracts, definitely would be the right thing to do. But I recognize that the government isn't going to fund everything, and I do think if I was to prioritise something, it would be the continuation of free lateral flow tests, and that's why I've made that call today. On the second part of your question, Owen, the reason I mentioned the 2 years and the day of reflection was precisely for those people and others who will be today. Kind of just still trying to process, I guess, everything that's happened over the last 2 years. It has just been an extraordinary time that we've all lived through. Every family has sacrificed something one way or another, but sadly, some much more than others. And I don't think we have supported them on this journey as much as we should do, particularly when you kind of listen to what was said in Parliament at lunchtime. It's kind of as if it's all over, it's all gone, it's all forgotten. And of course, don't forget, there are people who were excluded from public support during the pandemic. 3 million people, many of whom live in Greater Manchester, who are still not just struggling with the cost of living, but they're struggling from the overhang of that, the debt that they incurred because they were excluded from public support. So I think there's a lot of people will be reflecting on many things today. On your point about memorial, we did create a digital book of remembrance, which we stood up during the pandemic. But I know how much the Memorial Wall in London has been valued by families who've lost loved ones. So without being able to commit firmly to it, I could certainly say today that I hear what the families are saying, and of course we'll talk to our council leaders and other colleagues about that. How we would fund it, how we would do it, well, those are questions we'd have to look into. But I understand why bereaved families will be making that call today.
Thanks, Andy. Final question is from Katie Hazeldine. Just want to say where you're from, and you should be able to.
Hi, Katie.
Hello. On, off. Hi, Andy. It's Katie from That's Manchester. I know we have touched on it a little bit there with the National Day of Reflection, but I just wondered if you could summarise for our viewers maybe a tribute just to all of those that were affected, and obviously the key workers that, you know, continued throughout the 2 years and will no doubt continue with the effects of this for many years to come.
Yeah, thanks, Katie. I'm glad you've asked that question. It's a good one to end on, because I would like directly to say thank you to everybody in Greater Manchester for the way in which people helped each other through over what has been a really difficult 2 years, probably the most difficult 2 years of our lives. You know, when you look at everything else that's going on in the world, and you know, all of the, if you like, the overhang from the pandemic in terms of the mental health impact, but also the financial challenges it's left. You know, this has been really, really tough. What I observe is people putting themselves out for each other, be that people working in A&E or in our hospitals, or our paramedics, or people working in primary care, or be that obviously our social carers. And it's why it's not, you know, a sort of coincidence that at this moment in time our 10 councils have all made a commitment going forward here on in to ensure that our care workforce gets at least the real living wage. That's Greater Manchester's response to the pandemic, and I think it's the right response, and it's more than words, if you like. You know, we are recognising what people have done here and some of the things that need to change. When it comes to kind of families, neighbours, communities, I mean, people have done so much to support each other, and you know, it was really difficult at times, particularly in the second lockdown and, you know, early in 2021, but people were still there for each other, and it's right to thank them for that today. We can celebrate our resilience as a city region, our togetherness, but there's no doubt that the pandemic has left a mark on Greater Manchester, and we need to continue to work with each other together to help people recover, and particularly to help our younger people recover, many of whom were the most disrupted by what's happened. So that thinking is why, you know, we are very focused on those cost of living measures that I mentioned before, because we recognise this is going to be a really tough year for people. And while we've had some welcome measures announced by the government in the spring statement today, as I said at the start, this is a package designed to help some people, but not designed to help everybody. And that's why we're going to have to do more ourselves to support people through what will be a really difficult year.
Thanks, Andy.
Thanks, Kate.
Thanks, Andy. That's all our questions for today.
Good. Well, thanks, Ross. Thanks to the team. And that's within time, isn't it? 1 minute within time. Thanks for tuning in, everybody. Hope that was interesting. See you soon.